Hey y'all, welcome back to the channel. If you're new here, I am documenting my life post being laid off. So showing how I try to find a new job, paying off debt, and just navigating life like one step at a time. Today's video is all about health insurance, which is a very confusing thing to navigate without having a job because in America, jobs are connected to health insurance and they go hand in hand. Yes, America. So it's a confusing thing and an expensive thing to figure out healthcare when you don't have a job. So in this video, I am going to discuss COBRA, what that is, and the pros and cons. I'm also going to talk about Healthcare.gov and some other important things to know about healthcare, particularly if you are low income or no income. So when you have a job, your employer covers your health insurance. You, as the employee, you will pay a small portion, or at least for most companies you will. There are some really cool companies where you don't have to pay anything. But for most companies, you will have to pay a smaller portion of health insurance, and then your employer, they cover the vast majority of that cost. So you may be thinking, what happens to your health insurance when you lose your job? That is when you have an option to choose COBRA. COBRA stands for Consolidated Omnibus Budget Reconciliation Act. A very long name, which is why they just call it COBRA. It's a federal law that was started in the 1980s. It basically allows employees and their families to continue to use their employee-sponsored health insurance after losing their job or experiencing some other type of qualifying event, like significantly reduced work hours, divorce, or if the covered employee passes away. So with COBRA, you get to use that same insurance, but you have to pay the full premium by yourself, plus a 2% administrative fee, since your employer is no longer covering you. So some good things about COBRA is you won't have any lapse or gap in coverage. So you get laid off, pretty immediately, you can enroll in COBRA and it'll be like nothing has changed. You'll still get to use the same doctors, you'll have the same medical plans, the same prescriptions. You'll still have access to everything you did before you got laid off through your employer. It's just that now, instead of under this umbrella of an employer, it is under COBRA. And so while that sounds great, you may be thinking, well, why not choose COBRA? Because it's expensive. It's expensive. And when I say expensive, usually I don't always use that word because expensive is pretty subjective. You know, what's expensive for me may not be expensive for you. But since the people who are qualifying for COBRA are people who don't have a job, I would say that COBRA is expensive for everybody, because on average, for an individual, you can pay $600 a month for COBRA. That is average, which means some people will pay less, some people will pay more. And that's for individuals. If you are a family, that means your average is $1,800. And again, for people who are unemployed, COBRA is expensive. It's also temporary. Like I said before, it can last up to 18 months, but it won't last for forever. So it is temporary. And you also have a limited time period to decide if you want to use COBRA. You have 60 days after losing your job to enroll in COBRA. After finding out how expensive COBRA was, I decided that was not the best option for me. So I decided to get my own health insurance. And there's a marketplace at Healthcare.gov, and that is where I got my health insurance. So when you lose your job, that means that you are technically under this special enrollment period that Healthcare.gov says okay, you got laid off, now you'll be able to get health insurance outside of the normal open enrollment period. And when you go through the process of applying for the health insurance, for me, well, not just for me, for everyone, you'll have to say when you got laid off, and you can't just do this at any point in time. You have to wait until COBRA is done. Like there's a specific window that you have, like I said, those 60 days. You can't apply for the health insurance on Healthcare.gov while you're still within this window with COBRA. You have to wait until your COBRA window closes, and then you can enroll in health insurance on Healthcare.gov. Because I tried to do it before COBRA ended, and it won't let you. Like there's a point in the application where you have to select a date, and you have to select the date that your COBRA ends, and it's not like you can jump in the future or the past. You have a window of time, and for me, I was trying to do it too soon, so I had to wait until COBRA was done, and then I could get the insurance on Healthcare.gov. And so while COBRA was expensive, I can't say that the options on Healthcare.gov weren't expensive. They were just less expensive than the COBRA ones. For me, they range from the $300 a month up to like $700 a month. Like it still wasn't cheap. It still wasn't cheap. There's a lot of different things to consider. So you want to look at what is actually covered under that healthcare. So some of them you can choose, like, are your doctors going to be in network or not, the ones that you were going to while you were still employed. You can choose if your plan has those same doctors, or if they don't, you can see what type of coverage they offer, what type of like benefits come with it. Look at how much you have to pay in a deductible, co-pays, all these different things to consider. So if you don't know what these words are, so a deductible is basically like, let's say your deductible is $1,000, and which is low. That's low. It's probably like unrealistic, but for simple math, let's just say that it's $1,000. And so within like healthcare, let's say you go to the doctor in January and you have a bill of $500. So you pay that $500. Well, your deductible was $1,000. So you still have another $500 that you have to pay towards your deductible for the year. So let's say the next time you go to the doctor is July. You go and you get another bill for $500. So now you have paid your total of $1,000 for the deductible. That means if you go to the doctor in September and you get charged, you won't have to pay anything because you've already paid your deductible. And that's when the health insurance will kick in sometimes. Because there's also things called co-pays. So there's some plans where even if you paid your deductible, then you'll have to pay a copay. So let's say it's like a $40 copay per visit. So if that, like I said, that appointment in September, you already met your deductible, but if you also have to do like a $50 copay and the bill is another $500, then you'll only have to pay that copay amount, and the other $450 in this example, the health insurance would pay. So hopefully that helped. I know all this is so confusing. There's so many different like terms and everything. They don't make it easy. They don't make this easy. While you are going through the application, there's a lot of different things to consider, and they have a way where you can like put them side by side and compare your different options. And so you're just gonna walk through everything and pick what's best for you. I should mention, before you do all this, they're gonna ask you how much money you think that you're gonna make that year. So not back when you had a job, how much you were making. Without a job, how much money would you make this year? So like for me, I lost my 9-to-5 job, but I still make some money like on YouTube. So I had to like estimate how much I would make on YouTube this year. And I don't know, YouTube goes up and down, so it's really hard to like estimate that, but they say like just do your best. So I try to do my best. Now, while you are going through this and you're looking at these options, and even on Healthcare.gov, the options are like $200 a month, $300 a month. That may be less than COBRA, but that still may be too much for you. And that's not realistic that you could pay that every month. So what do you do if you are low income or no income? Like, how do you have health insurance? So There is Medicaid. I'm not going to go into like super detail what Medicaid is because there's a lot of different resources out there, but Medicaid is free or very low cost health coverage for people with very low incomes. So that is an option to look into that for your state. There's also community health clinics that could be an option. So there are some federally funded centers that will offer care on a sliding scale, and they also don't require insurance before they help you. And another bit of advice is prescription discounts. So if you've heard of things like GoodRx, they produce basically like coupons for prescriptions. So like for me, I had to get a prescription renewed, and this was before I had enrolled in health insurance. And so my mom was talking to me about it, and she was like, don't go just through the driveway or drive-through for the pharmacy. Instead, go inside and go to the pharmacy counter, and they'll have these like coupons that you can use. And so I did that, and the prescription that I need to pick up normally would have been like over $300, but with using the coupon that was there, it brought it down to like around $38 that I had to pay. So a huge saving, all because I picked up a little thing that was on the counter, and the pharmacist didn't tell me about that. So it's not like they were trying to help me save money. But yeah, it's just something that you would look for on the counter, and it's small, and it's kind of like the shape of like a business card. But they're free, and they're just sitting there, and you can pick it up and apply it to your prescription, and it'll significantly reduce the cost. And that may sound like a really common thing, but you know, as an adult, I've never needed to use that because my prescriptions were always covered under insurance, so I never had to pay for anything. So yeah, it's just funny. You don't know what you don't know until you need to know it. So if you didn't know, now you know. To kind of like circle back to me and what I chose. So as I mentioned earlier, I did not choose COBRA because it's too expensive. I went on the marketplace on Healthcare.gov and I picked my own plan. So for me, I ended up with a plan that is $351 a month, I believe. Yeah, and what the crazy thing about that does not include dental or vision, because in America, healthcare is about your body, but not your eyes or your teeth, even though my eyes and my teeth are in my body. It's crazy how that works. It's crazy. But yeah, $351 a month, I think, and then a $7,000 deductible, which is way higher than any other deductible that I've had back when I had employee or employer sponsored healthcare. So that's crazy. There were plans that had lower deductibles, but I judge this based on like my own personal needs. I'm still pretty young, pretty healthy. I don't usually have to go to the doctor or to the hospital outside of like normal, what's it called? Like normal checkups type thing, like annual type checkups. So I'm just hoping and praying that nothing happens to me. Basically, I'm just hoping that nothing happens, nothing serious. And yeah, I can still do like my regular checkups and things like that. So I basically got the cheapest plan that I could. The cheapest plan that would cover like the most basic things. And again, we're just gonna hope and pray that nothing happens until I am somebody's salaried employee again. So for me, this is going to mean that I'm going to have to switch doctors because my old doctors are not in network, which is annoying because do you know how hard it was for me to find doctors that looked like me? And I strategically wanted doctors and my dentists, and I tried really hard to make sure everybody looked like me. And now I'm going to have to start that search all over again, which is annoying. Yeah, but you gotta do what you gotta do. And at least now I have a little more peace of mind. So, you know, driving around worrying like, oh, I hope I don't get into a car accident or something like that. Now, if that does happen, at least I have insurance. So I have a little more peace of mind, even though I have another monthly bill that I have to work out. So if you are recently laid off and you are trying to navigate, like, how are you going to get health insurance? I know that this is confusing. You know, nobody teaches you these things. This isn't taught in school. It's just, you just kind of become an adult. And if this ever happens to you, then you have to figure it out. So I know that it is definitely confusing, but it is figure outable, and it may seem kind of like scary, but you do have options. So I hope this video helps show you the options that are available. If you like this video, give it a thumbs up, leave some comments down below, and make sure you subscribe to the channel so that you don't miss other videos similar to this. And also make sure you share this video to anyone in your life that you know is going through a period of not being employed and they're trying to figure things out. Hopefully this video will help them. So thank you for watching, and I'll see you next time.